Okay, we are starting all the recording.
Do you want to share the screen too?
Well, it's 6:02 and I would like to go ahead and call the meeting to order. We do have a quorum, it appears, so I think the first we have to do a roll call. Susan?
Present.
Michael Chaffee present. Dr. Kingsley?
Present.
All right, we are aware of 2 absences right now. Zach will not be able to join us. And we've got a baby being
And
born.
Kim's daughter's having her baby.
Yes, Kim's daughter's having a baby. So we do have a quorum and we will proceed. I think the first item on the agenda is the Pledge of Allegiance, so if we'll stand. And I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, I don't think we have any guests or for public comments. Jeff, Susan, you guys had a chance to review the minutes from the 21st?
I don't have any questions or concerns.
Yeah, I have no
Okay,
concerns.
hearing none, I'll entertain a motion to approve. Susan?
I make a motion that we approve the minutes from November 21st.
Jeff?
Yes.
Call Susan?
Yes.
Jeff? Jeff?
Yes. Yes.
Michael? Yes. Minutes are passed. All right, and I don't have the agenda pulled up on the screen yet, but I will get there. So, next item, oh, God bless you. I was gonna pull it up. I'm juggling still. So old business, the final draft for the 2025 budget.
So that is in your packet. And just, there's a sheet in there that looks like this. That looks like this. That kind of goes over the major things. But the proposed budget, the income is set, we did that back in August. Is at $3,937,942. It's about $400,000 less than the 2024 budget. Largely, that's going to be because of a decrease in grants. There were grants, primarily COVID-related grants that we are not proceeding with, or they're not available. We've spent the money. And then there is an income decrease also because of the family health care clinic. Total expense, $42,13,854, about $124,000 less. And that difference there mainly is due to things that we're encumbering from this year's budget that were approved in this year's budget, but we'll be not spending until next year. So things like the HVAC, the
Tuition reimbursement,
hopefully, the pay increases.
hopefully.
And we'll see, I mean, those have been approved, so that's why that's done that way.
So Andrew, I have a quick question for you. You and I already talked about this before, but I just want to make sure it's public. So we have these changes, but going forward though, going beyond 2025, we don't expect to have these expenses or these concerns with the revenue coming in, do we?
No, next year, the revenue will catch up with at least the pay raises and, we will be fine. It's just this year, because of those decreases in primarily the grants and some of the things we're doing, I know like even with the STI fees that we waived and we're getting back, I think, with the board in February, I think. We're going to have to look at some of those things, but as we discussed in our one-on-one, Dr. Kingsley, some of that is also because we're doing some of those things, like we won't be just testing everyone for herpes, which is one of the more expensive tests. So some of this is cost analyzing as we go through this year without the clinic, where the clinic had done some of those things for us.
Right.
We need to make sure we are looking at those things.
Mm-hmm. Okay, just want to make sure it's public record that we expect this not to be the case going further. There might be some unexpected expenses we're not aware of, but going forward, we shouldn't be have these kind of changes. So, okay, that's all I had to say. Thank you.
So our relative position just in our money market from November 30th of 23 to November 30th of 24, we had $678,382 more at the end of the month. Our reserve account balances, as you all know, we didn't have them until this year. So we have about 43,638 in two different accounts, our operating reserve and our building reserve. So close to $90,000 that is now, and you all know this, but just for the benefit of the public, that is specific to in case something unexpected happens, and we will be increasing that. And the 25 budget includes 10%, 1% of the income for each of those accounts. So approximately another $45,000. Well, I guess it would be about $40,000 in each of those. Human resources went down by about 73,112. As you all know, we lost some positions, but then we gained some positions, but ended up below where we were. And then something I'm excited about is the last thing is the lease purchase balance remaining. On December 13th of 23, we were at $2,525,763. A year later, roughly, we are at $2,312,252 on the balance remaining. So about a $213,511 decrease, or 8.8%, which you figure that means we're just over 10 years old. I mean, it's actually not going to be exactly that. It'll probably be maybe even under 10 years, but we're right at about 10 years of paying that off. And originally,
And what was the
30
Andrew,
years.
what was the for the public? What was it supposed to be that we were expecting versus what it actually is going to be? So we were trying to do 15 years to have it paid off, and now we can almost get it done below 10 years. Does that sound about right?
It'll end up about 12.
Well,
Yeah.
It'll end up about 12. But
Yeah.
originally, that note was for 30 years.
Yeah. So I just wanted to put in the public record that we're way, way ahead of schedule.
I'm curious if the proposed budget, if the savings we have from not operating the clinic to the tune of $750,000 could not be, how much of that could be targeted to paying down the debt?
So the savings didn't end up being that much. So it was probably, it's kind of hard to tell. So this is a transition year. So it really is going to be probably more around 300,000 to 400,000, but we've also increased expenses. So things with additional positions, pay raises, different things. So I'd say the big thing we're doing is getting away from primary care and putting those resources back into community public health initiatives,
right,
and building our health department and that type of thing, if that makes sense.
Is there a plan to aggressively pay down this debt, or
So
have we arrived at, I mean, is this budget include a plan for our debt pay down? Is it acceptable?
So we are paying about per month 25% more than what we need to.
Yeah, about $5,000.
Yeah, it's about $5,000 a month more, or $60,000 a year above right to principal. So yes, that is,
And with that payment plan, paying more than is required, we will gain a lot of decrease in costs of the cost of the money, which is the interest.
right.
But at current rate, we're looking at roughly 10 years. Is that about accurate?
I think it's probably right at 10, if not a little less.
Well, with the, my own personal comment on that is with the interest rate where it is, it's very reasonable. But at the same time, 3% is still,
It's still 3%, and I personally don't like that hanging over our head.
agreed.
So the sooner we can pay it off, but we want to make sure we're balancing providing services and paying off the debt. So, and we're also trying to fund these reserve accounts
Yes.
too, to be financially responsible. So
Okay.
everything's we're trying to balance all these different plates.
So due consideration has been given to aggressively paying down the debt while balancing the need to establish and operating and building reserve funds and fund those as the board has previously recommended.
Right.
Good enough.
Sounds good.
Okay. Susan or Jeff, were you finished on the budget?
I am, just so
Okay.
you have
I was
that.
gonna say, Andrew and I already talked before in our little monthly meeting about all these things, so I'm totally fine with it. So unless you guys have issues, I'm ready to vote on it.
Susan?
I'm good.
All right, then I'll entertain a motion.
I move that we approve the budget for fiscal year 2025.
And I second it.
I'll go roll call vote. Susan?
Yes.
Michael, yes. Jeff?
Yes.
And we'll move on to MOSIP, Financial Advising and Investment Services.
So you should have a couple pages that are very colorful. I think at last month's meeting, we had talked about, we had opened the bids 2 months ago, and we only got one response to our request for proposal for financial advising services. And we said, we want to take this back to the finance committee and kind of study the issue. Sorry, I'm stealing your report.
Oh, please, go right ahead.
But so Jen Snyder, our attorney, came in, kind of interpreted what the proposal meant, because Dan's really smart. I'm sure he understood it, but I needed some help. So she came in, spoke to us, and said, you know, everything looks good. The one thing I would advise the committee to do is check with their references and see if they feel like they're getting all the stuff that's being promised. And so we actually did that. We sent it out to 5 different entities, got responses back from 3, and that's what's in the packet. And, you know, just to do our due diligence, everyone that responded was quite happy with the services. We still don't know exactly what the types of finances or types of products we're going to be investing in. We're going to need assistance. But I guess what we're asking the board at this time is to go ahead and authorize me to establish that relationship with MOSIP. They're going to come in, talk to the finance committee, and advise us on how to do this the best way. You know, every year we have an influx of money during December and January when property taxes are being paid. A lot of that money we don't spend until November, December of that next year. We want that to yield as much as we can during that time frame, which would be above what our money market is. But we don't want to pay penalty if we would have to get to certain monies quicker. We want to be able to get it in a reasonable time frame. And there's just a lot to discuss with them. But at this time, Susan, do you have anything to add?
No, it just seemed like, well, not over what you have said, but just to make one comment, and that would be that the MOSIP just seems to be, for our particular institution, the most probably safe way to go.
Because they will 100% follow the state treasurer's guidelines on investments for public entities.
All that I'm sure would be part of their contract.
Right.
So can I, Susan, if you know the answer to this, so let's say we do put, like Andrew was saying, we put the money in at the start of the year, and we have a huge chunk, whatever that percentage is, that's sitting there. But all of a sudden, there's an emergency expense that that just popped up. What is the time frame that we could take the money out in real time? Also, what would be a penalty? And then what is the time frame that you can touch money that without being penalized or whatever? Have they talked to you about that, or do we know anything about that?
That's what we're wanting to find out as well. And that's what
Okay.
we'll probably have at our next financial meeting.
So Dr. Kingsley, basically they have a range of types of investments we can do. And we could do everything in an investment type that essentially there'd be no penalty by the time we would need the money. You know, it wouldn't be more than 30 days anyway, because we are going to have to budget that money. But because of that, we have a whole wide range of things. And what we would probably end up doing is tiers. Some parts of the money would be immediately available. Some parts would be midterm, you know, maybe a few months, and then others might be even longer.
Right. Okay. And then I guess when you ask those questions, what would be the percentage that we could do in those 3 different boxes that you're talking about? Like what would be acceptable? So.
That's the discussion we're
Yeah.
wanting to have.
We'll have to bring more information back to you.
That's fine. Okay. Thank you.
Do we need a motion for this
To have me arrange a relationship with them, yes.
to engage in interview or
Just
to
contract
establish?
with established services.
Good, let's move as much as we can. I would make a motion, even though I'm running the meeting, I can make a motion.
Yep.
Yeah.
I make a motion to authorize Andrew Warland to proceed with engaging the services of MOSA for the Finance Committee to review and bring back recommendations on how best to proceed.
I second
I'll
that.
second it. Oh, I beat you, Susan. Sorry.
All right, then I'll take a vote on it. Roll call, Susan?
Yes.
Michael, yes. Jeff?
Yes.
All right, strategic plan RFP information.
All right, so we put out a bid for strategic planning consultant, and we had received 8 different proposals. All of them seemed like pretty good proposals, so we ranked them for different things, including the cost, the content, their experience with strategic planning, their experience with working with the accreditation body, their communication style, clarity and uniqueness. And ultimately our recommendation is to go with MOSIFI, which is the Missouri Center for Public Health Excellence. First of all, their cost is way less than everyone else's. And we wanted to make sure we weren't just going with the cheapest if it wasn't going to be good, but we spoke to a few of their references and people who've worked with them and have done strategic plans through them, or other plans have worked with them. They've received funding from FAB, the accrediting board, and they've been working with them on a lot of plans, and they had good references, and this will ensure that we're able to do the whole strategic planning process. We had asked for the base price to be under 30,000 or 30,000 or less. And then we had said there were a few additional components that we could add on that included actually writing the strategic plan and doing the environmental scan, which would be the beginning part of the process, which is doing surveys and individual interviews. But I think the reason that it is so much less is because we're a member of MOSIFI and we got a discounted rate. So we would recommend to go forward with MOSIFI as a strategic planning consultant.
So I have a question. Yeah, so between MOSIFI and the Flourish and Thrive, since that's 1 versus 2, what was the biggest difference that you guys saw between the two? Besides, it sounds like the services would be equivalent. Is it just it's a money issue? Is that pretty much the only difference?
I mean, that's the biggest thing. It's hard to tell until we've actually worked with them. But Flourish and Thrive did have good recommendation or good references as well, and came highly recommended. But when it's 46,000 versus 18,000, I even talked to somebody who had actually worked with both of those entities, and I mean, they said that if it was going to be more, they would go with MOSIFI, and that was their recommendation.
Now, Taylor, my understanding was the services weren't the same. The second one did not include all the writing and the
It
environmental.
depends at which cost you're looking at. So for the 29,000, that was just to do, basically running the retreat and doing the strategic planning conversations, the facilitation. But that 46,000 was with the add-on components. So sorry, I was comparing the total amounts if we were to use them for all of the services. And Mosifi did also say that they're willing to do some trainings and things for us included in that price.
So my comment is, for the record, based on the methodology that you have presented to us on a scoring evaluation, the top two scorers were 95 and 94, with none of the other bids breaking into the 90s, and that the cost for the Mosifi is $20,000 or more less. And your experience with Mosifi is good, and it is the opinion of the executive team to recommend Mosifi to do the strategic plan. Is that fair?
Correct.
I'd entertain a motion.
I'll move to authorize the director to negotiate acceptable contract terms with Mosifi for strategic planning services.
I'll second it.
Roll call, Susan.
Yes.
Michael, yes. Jeff?
Yes.
Director report.
I do want to just say something about this process,
Oh, yes, sure.
real quick.
Of course.
Taylor did a great job. And I say that because this is one of the most number of questions we've gotten from any request for proposals that we've put out. Like almost every day for the 2 weeks up to the due date, she was getting questions for one or multiple of these potential vendors. And she was quite busy responding to them. And they all, and I know Dan, in the past, we've had questions and we've put it out, you know, like an updated thing so everyone would know. Well, they were all asking really different questions. So there wasn't, we all had certain priorities, but I just want to say thank you, Taylor, for doing that.
Well,
it's kind of an interesting
This
ride.
report was unbelievable, so thank you. It made
Now, to
it.
be fair, I think she copied from one of Dan's.
Did you?
What?
You did
It's
a
a
nice
good
job.
feature.
You did a nice job.
I hope my comments, let me clarify them. In no way, shape, or form is my 20-second or 15-second soliloquy going to encompass the breadth and depth of work you have done to put this together.
That's correct.
For purposes of getting this stuff through and getting the meeting moving quickly, I wanted to make sure that we had an objective evaluation, that the executive team, based on your hard work and exhaustive work, and Andrew, thank you for pointing that out. I certainly didn't intend to minimize the
Yeah.
work.
Me either.
Let's give
Go ahead.
kudos. Good.
So Taylor, can I butt in? Sorry. Taylor, so going forward, how does this play out? So they will contact you and then you will have like an executive meeting with them and then they bring the stuff in front of us, or how does this actually play out going forward?
I'll reach out to them and then see what the process is gonna be. I didn't put the whole proposals are not in here, because some of them were like 80 pages long. But we essentially will start setting up meetings with them. They'll meet first, I think, with the leadership team, and then we'll set up a time to do either interviews. They might be interviewing you all as well, and then also including you in the retreat and some of the further discussions. So now that we've chosen one, I need to reach out to them and find out the next steps.
And then when you say retreat, like an actual retreat, or is it just like they come to the health department and we just, they spend a day with us, or how does that actually play out for that as well?
Going to
No,
Vegas, baby.
Mexico.
Going to Vegas? All right, I'm with you.
Not in the budget?
It's Christmas. I'm kidding.
Yeah.
I'm
Approved the budget already.
Whoever's doing the minutes, strike that. I can see now, we're going to Vegas, baby, and
Our thought with the retreat is doing like essentially like a full day retreat. I think we're gonna do it at another location, but we need to determine where that will be and exactly how that's gonna work. But it will be
Very good.
around
All right,
here.
thanks.
And we intend to close for business on that day, just so you know, because we're going to try to work it so all the board, I mean, you'll get notice in advance because if possible, we would like all the board members to attend. I mean, this is a joint thing to
It's
do.
my opinion that I think, and I can speak for all the board members, because I know them all well enough that we would enthusiastically love an opportunity to participate.
Yeah, it's really,
Let's
you know, it's
Honestly,
all,
just give me a heads up ahead of time so that I can make sure my schedule doesn't conflict. So
We need an action item or to approve this. Oh, I thought we just
I
did.
think we
we
already.
did,
It's okay.
I
Let's move on.
I'm sorry,
No, don't be.
Andrew
Don't
was
be.
like, you're moving too quickly, so.
but we'll
Slow
go
down.
to my report.
All right, director's report.
So you can go ahead and go down. I'll just touch on the main things. At the November board meeting, we did approve the change order for the HVAC. I submitted the change order, or I told them on the next day. I approved the change order the next day. Locked in the pricing. The price is the price. No going up or whatever they thought may happen, which we have no idea whether it was going to or not, but it's in the works. I'm going to defer on number 3 because that's later in the agenda. Do want to talk about our budget. So at the end of November, we were at 4,038,501 or 93.1% of our revenue. We were at 84.4% of our expenditures or 3,662,408. So we are continue to look good throughout the year. Our money market balance, we were about 321,618 more than we were in 23 at this time. And one thing I will add, and it's pretty much the same as what was in the budget discussion, but I am going to just add that lease purchase debt obligation to our budget overview, just so we can see that monthly.
Great idea.
And then this budget line item increases. We kind of talked about most of these already because they were board approved. And then one of the other agenda items is tuition reimbursement, which is the only optional thing. And we'll talk about that here shortly. So we'll turn it over to Dan.
Right, deputy director's report.
Mainly a lot of business as usual. See, we have been working, or at least beginning conversations with North Kansas City School District to partner with them in a similar way that we do with Park Hill School District, where they would send students through their college and career pathways program. We would host those students that are interested in careers in public health or healthcare in general. With that program, participation in that program would begin in the fall semester of 2025. Let's see. Yeah.
Dan, just a question for you. So do you do that at their schools or do they come to us?
It would come to us usually about 1.5 to 2 hours a day, 4 days a week for several months. We've done so in the past with Park Hill, and it's been, I think, good experiences for both them, as young people interested in a career, and it's been good for us too to have an opportunity to share our experiences and act as a bit as educators. I did want to share, Andrew and I are attending a leadership challenge, which we participated in a webinar, when was it, December 13th, led by iLead Consulting and Training, which is a firm that the Department of Health and Senior Services has hired to offer this leadership training throughout the state. The first cohort, I believe there are 16 of us participating. And part of that is to do a 360 assessment where we've chosen about 8 to 12 folks who will answer questions about our leadership styles and pro and con, I think. And then we'll go offsite and meet in Columbia in late January to attend a workshop.
So,
So-
so Dan,
I
who
don't-
is the target audience for this? I'm just curious.
I think for the most part, it's leadership at local health departments.
So
I
other
think
directors, deputy directors, okay.
I think there are some state employees participating and other entities represented.
Not that I know of. The state health department is funding it. So that's why it's all public health people. I don't know if Dan sent his 360 invite to the board or not. Mine will be coming to the board. So you'll have a chance to, both of you, I know will say wonderful, nice things. Dr. Kingsley will get to do his typical thing. So exactly. So, but you will, the board will all the board will get mine. Because a 360 is going to be your bosses, you know, your peers and all your direct reports. So
And then, so then what happens when this is over with it? Then they show that they've taken these skill sets with them and whatever, or is it just they take off and then we'll see you next year kind of thing, or how does this actually work?
So typically for the 360 and you get those results back and you see what areas you're strong in and what areas you need improvement in. And then they're going to kind of give you an individual curriculum to work on the things where you are maybe need improvement. You know, Ian has already told me he needs no improvement, so he expects perfection. So he'll be good. He said, I had a lot of work.
Mhm. Okay.
But Mid-America Regional Council used to do a similar type of leadership training. And the 360 is very, very valuable because a lot of times we're self-aware, but a lot of things we aren't. And, you know, it is very helpful to see how people view you.
And I think it's exciting to see part of our, I know the board and Andrew place a lot of emphasis on the workforce development. And I think this is one good example of that. But another one is Tricia Rothweiler, our health education supervisor, recently completed Katy Public Management Center's Emerging Leaders Academy. She graduated at a small ceremony at the Kansas City Library downtown. So I think Tricia learned a lot going through that. She's already a natural leader, but those kinds of opportunities for our leadership staff, I think, are great. That's really all I have. Let's see if anyone has any questions.
Questions?
No question.
All right. Clinic manager?
Yeah, so a little big highlights with Swope, they are working on getting a dental hygienist workspace. It's in like the second to last clinic room that they have on their side of the clinic. We already cleared out the old bed that used to be in there, and they're working on getting some supplies in. They are hoping to have that up and running sometime by the end of, or they're wanting hopefully by the end of this year, but more likely by the start of next year is when that's going to be open and operational. We'll be sharing more information once that becomes available. They are currently working on a client satisfaction survey for this specific location. They do it for most of the other ones. It's through all their IT, so they're working on building it that way. Anyone who comes here will be able to get that feedback, and they said they would share some of those results with us once that is available.
Yeah.
So hopefully we'll have that available by the next board meeting. As requested too, they are up. There's a few more patients. They saw 59 total for the month of November, so they're all still working on slowly building up that patient base out there. WIC did get to celebrate their 50th anniversary at the Missouri WIC conference in Branson this year. All the WIC staff was able to attend. They took a lot of different, they learned a lot of different great things. They are working more towards a browser-based program for like the WIC software, as well as their cards are going to be more of online. system of ability to use, kind of like a debit card. That would be a lot easier than having to hand out the paper vouchers like they used to for those. We did a few different flu and COVID clinics up at Riverstone retirement community, as well as working through, I think Dane had a portion of his report for all the daycare audits for, what was the number you had, Dan? It was quite a bit, and I saw it. 486 immunization audits at 7 child care centers. So I know Health Ed and Carla was helping us with that, performing those audits. So they did a lot of really great work for that, getting everyone caught up. One more thing. A fun little case we had, I don't know if you saw in my notes, we do currently have one active TB case. It's a genitourinary infection. So the specific patient actually, that was my exact face whenever we read about it too. So
Urinary TB.
It's apparently 25% if you don't get treated for TB, but 25% of patients will actually develop that later in life. Usually they say it takes about maybe 20 to 30 years before it actually progresses that way. So what happened with this patient is for the past year, they've been having like these scrotal infections and abscesses, and they couldn't really figure out exactly what was going on. And so they went to this different hospital and they ended up running a culture for mycobacterium, which came up as positive. So we've been working with him and his family, and he's doing a wonderful job. A month later on treatment, he said remarkable improvement. He's feeling a lot better. So we're getting him taken care of right now. But I remember telling Andrew about it, and he thought that's like the most interesting, wildest thing he's ever heard of for a TB, being extrapulmonary there. So,
Right, that's interesting. So it's actual abscesses, huh?
Yeah,
Oh,
he had a couple other things going along with that, but when they were trying to diagnose everything total, they found that was one of the issues, was the mycobacterium growing in there.
Okay, I have 2 quick questions aside from that. So I saw that the total patients are 59. What was our total that we saw the year before for that same time frame? For school, for number section 3 there.
I think I have a number. Do you have on your?
I can look it up.
Okay.
I'm just, if it's equivalent or if they're actually seeing more than what we saw, I'm just curious. I know they just started, so it's probably not really a fair comparison.
Well, while they're looking that up, let me know when you guys have that information for Dr. Kingsley. And
So hold on, I got another question though. So collaborating with SWOPE to care for hepatitis C patients, how does that work too? So
Yes.
do we refer them, or how are we collaborating with them? I'm just curious.
So I had a call from Dr. Jamal earlier in the month, and they have like a hepatitis C coordinator. They wanted to kind of touch base with me and kind of discuss a few things. So we do provide hepatitis C testing through the Hep C Alliance, and normally once we get the positive results, they pretty much take care of everything, the case management. They'll get someone established with the provider and do everything from there. So was trying to hope like be able, since they work closely with us, be able to connect that way. So I spoke with the Hep C Alliance, and they said that is perfect. It actually makes things a lot easier for them. So we're trying to work. We don't see a lot of positive hepatitis C through that program, but we're working with SWOPE now. So we'll be referring any clients that come up positive to them to be taken care of.
Okay, I thought it was part of our STI testing or something that we were doing, that we were actually catching these. That's what I was curious about.
It eventually will be, but like I said, we see so little hepatitis C patients. It probably won't be used a lot, but we will be having that partnership with them.
Okay, very good.
So in November of 23, we had seen 94.
Okay, so they're a little bit more than half of what we had, but they're just starting. I was just curious what the difference was.
Yeah, I mean, I'm sure it's growing, the practice.
Okay.
Down the road at some point, I feel we have a duty to evaluate the effectiveness of this vendor, SWOPE, on meeting the needs of the citizens of Platte County. I'm not sure the best way to go about that, but clearly we can't do that as they're gaining traction and getting going. But at some point, I feel the board has a duty to take a look and make sure that there are no issues with the provision of such services for our citizens. Don't know the best way to do it, but I throw that out there that as we get along, maybe at 1 year from October, we might want to just track how things are going.
And I know Dustin kind of explained like the patient satisfaction report isn't fully up and running, but I believe Dustin, you were going to actually put a report into your
Yeah.
clinic
That-
report.
that-
So we'll have that we kind of, the,
We kind
any
of talked
issues.
about that.
But we're still it's still a little bit in flux and
Yes.
It will be,
Oh, yeah.
it will be, but I believe we have a duty, a fiduciary duty at that to the citizens to make sure that this clinic we're monitoring the effectiveness of what they're doing. And part of that is the patient satisfaction. So that we are gonna, I feel we should monitor this vendor's responsiveness to their patient satisfaction reports.
I agree.
and we're still having some growing pains just between our staff and theirs and getting on, like, just understanding the processes on both. Because essentially we have two different businesses and we're trying to make sure we are collaborating and cooperating, and some of that is just, you have to find your rhythm.
I agree.
One thing, you're done with your report,
Yeah.
right? Back to Dan's just real quick, because Dan said something to me that I just think I'd want to point out. So Bailey Moore is our new environmental public health supervisor. She started in that capacity maybe 3 months ago.
And that's the young lady who got the best door decoration?
Mhm.
Oh, did you?
It is,
You did a good job.
Attention.
Yep.
it is. And she has
Took notes even.
She has two staff that are new to the health department here. They've been here probably 60 days at most. I think one started before the other, so one's been here a month and one's been here 2 months. And just the dynamic between Bailey and her team, which is Kyle and Rachel, Dan is like, I'm so impressed. They are just, they're learning their position here, but they are just such passionate already about their job and learning and doing such a good job. And I just was so impressed that we have that team building, and it's exactly what I want to see. So
They really enjoy
So
each other.
is Kyle, I was gonna say, is Kyle and Rachel going out and doing solo now, or is Bailey still overseeing kind of what they're doing?
Right now, they're doing a lot together. As soon as they're both, confident, which happens quickly, they'll start venturing out on their own.
and when he said together, Kyle and Rachel are doing them together.
Right.
So
Okay.
Bailey's out doing her own thing, but they are, having that team like that is kind of good because Bailey knows it all. She's not needing to learn anything.
Right.
But they both have things to learn and they're teaching each other. It's really building a great, strong team.
Very good.
Sorry, Dan, you had told me that. I was impressed. I think it's to you, Taylor.
I feel like a lot has happened in the last month. I didn't write a ton, but hey, we finally have done our official registration. So we have 1 year from December 3rd. So we have till December 3rd, 2025 to complete all of the documentation for accreditation. So we've done a few trainings on how to do that and sent out information. So everybody in the health department pretty much is helping out with the process. So different people have different roles and some people have a lot more to do than others. But we have this giant spreadsheet to track all of the stuff, to make sure that we're reaching each of the measures and standards. But it's been very busy. We also are almost done with our community health assessment. We got back a preliminary report from my Boswell, who's the consultant on that. We do it through the Northland Health Alliance. And we got back 6 large theme areas. So then we just completed the root cause analyses for those 6 areas with different experts from each area. And so we should have that, I guess the end of the year is in 11 days. So by mid-January, the community health assessment should be almost done. And then we will be meeting to determine the next CHIP priorities, the community health improvement plan, the priority areas. So right now we have the access to mental health and behavioral health, access to healthy foods, and access to transportation are the three task forces. And I'm overseeing the transportation task force. So we've had a lot going on with that. And we're working on the transportation hub for the Northland and a few other things. So
These reports,
Taylor, I have a question. So with Northland Health Alliance, so the iBoswell thing, this is the first time I heard of them. So they identified major themes. So what is their kind of the role? What are they trying to I guess accomplish, or what are they looking for?
they're basically the consultant. So how we hired like the strategic planning consultant. So but it's a little bit different because it's not as much that they're facilitating meetings. They're doing more like project management. They facilitated the visioning session, which was the first thing that we did. I think that was back in, I want to say April. And then they've been just working on some of these things. So they have come out with a couple different reports from this information, which will eventually turn into the community health assessment. And then once we have the completed version, then we will share that with you. I don't know if that's too big.
So did they function more as like a like not disinterested third party or something, but essentially a third party that makes sure that we are saying what we're saying, or are they like double checking what we're saying, or what? I guess what do they actually do when they send their forms in?
Jeff, let me put it in quick context with you. Northland Healthcare Alliance and iBoswell published a March of 23 summary report upon which the recent sales tax initiative was based upon a need for children's services in Platte County.
Right.
That is the document that apparently in the press was referred to, which I did a deep dive on it, and I was concerned at the lack of statistical relevance, the lack of denominator data, and much of their conclusions were based upon surveys and interviews that were not substantially objective. So
Dr. Pape, those are two different groups.
they are. No, iBoswell.
Northland Healthcare Access and Northland Health Alliance are two different groups.
Okay.
And what we're doing our work with is Northland Health Alliance. Northland Healthcare Access.
Thank
you. Provided us funding for our family health care.
Thank you. Well, I wanted to be sure
It's
because
Karen Dolt's group.
it's to me, it's almost like a shell game. Northland Healthcare Alliance and Access.
They're totally separate, different
Okay.
boards.
Thank
Now,
you.
some of the players are the same in each, but they are totally separate entities.
Okay. So
Yeah,
when iBoswell makes their report, how do they get access to that information to make these reports? I'm just curious.
So we have a data task force, and so the data task force, so it's compiled with the same people who are in the Northland Health Alliance, but the people who are mainly working with the data. So like our epidemiologist contributes to that, and we work with Clay County. Largely it's largely health departments. There is some input from the hospitals and other organizations, but we're pulling the data. So through my sidewalk, we're able to pull a bunch of data from like the CDC Wonder data, Essence data, lots of different sources. So we're compiling the data, and they're really just taking all of the information and writing it out. They're more like a project management group, and then they write out some reports as well.
So they work hand in hand with you. They're not just doing, like I said, they're not a third party that's trying to like not audit us, but whatever, trying to make it like a disinterested party, I guess. So they're actually working hand in hand with us to do this stuff.
Yeah.
Assessment is largely all these different established data sources that Taylor mentioned. But the other thing you might remember is we talked about doing an actual survey, a community health survey to the people. And we took that like at our back to school fair, and Taylor gave incentives. That is the other part, to get real local data from people that actually live here as
Those
opposed,
are the ones we
so
took to.
we combine,
We-
what iBoswell kind of does is takes everything that we're giving them and includes it with these standardized other data collection things to give us a picture,
Okay.
if that makes sense.
No, that makes sense. So then when they send their information in, that they've already showed it to us, we've already seen it, we're all on the same page when it's sent to the accreditation board or whatever, right? I just want to make sure that's the case. I
Yes,
just don't
so
like
they're
surprises is what I'm trying to say, I guess.
able to read it and make edits, and we've been giving a lot of feedback along the way.
Okay,
A lot,
very good.
lot of feedback.
All right, thanks.
I will correct my misstatement. The Northland Community Foundation
Okay.
did a community needs assessment summary report published March 23 in conjunction with iBoswell.
Okay.
So
And iBoswell does work with a bunch of different groups. They are, you know, an independent contractor that provides consulting services.
I could see where Mike's saying that
They're
everything
not our-
could be kind of incestuous if you have everybody that's on the similar people on all the same. I mean, he and I are kind of hypocrites because we're also on the board of services too, right? But he had the same players kind of doing the thing in the different groups and different foundations and stuff. It's kind of interesting, I think.
So they did submit for our strategic planning too. They submitted a proposal, right?
Right,
And they were, you can see where they were on our score sheet, so.
right. Okay, I didn't mean to, I was just curious. I'd never heard the name before, or if you did tell me, I wasn't listening. So I apologize that that was the case, but okay. So they're working in conjunction with us to get this fast forwarded, hopefully get this done on a reasonable amount of time. So I appreciate it.
You know, I think that does bring up a point that has bothered some of us, that Northland Health Alliance and Northland Healthcare Act, those are such similar names that I get confused too. You know, I mean, it's, and I wonder if, this is a discussion for another time, but another name for the organization.
So, and I know they've talked about possibly changing the name because of that, because there's been confusion, and
Yeah.
even is it the chair or the president has used the wrong name before when
Yeah.
introducing the group
Wow.
at an event. That's actually the event you went to, Dr. Kingsley. He introduced it with the wrong name. You were there too. But they also are working on strategic planning. So the Northland Health Alliance is doing strategic planning, and then so we'll be part of that process too.
Hey, Taylor, hold on. So when I introduced the doctor for Swope, is that what you're talking about, or what are you
No,
referring to?
no. We went to that event on the
Not you.
rooftop.
Downtown,
Oh, okay. Yeah. Okay.
And-
I said the wrong thing. If I did, I didn't know better. So.
not
Dr.
you,
Kingsley.
not you.
Oh, okay.
Executive
Good.
Director of Northland Health Alliance said it wrong.
Oh, okay.
Some other mistakes.
No, they accidentally introduced it as the Northland Healthcare Access, I think. They meant to say Northland Health Alliance.
Yeah, it's very confusing.
So,
I would suggest Healthier Northland, but.
all right, Dan.
Yeah,
Dan got thoughts.
yeah, I know, well, Healthy Northland is already used by Duluth,
Oh.
Minnesota, and then that area,
Oh,
but
Looks
Healthier
like
Northland.
Dan has a career after he retires from the health department. Sounds
Yeah.
like he's gonna be running the show over there. I like
He's
it.
good with coming up with names. He has all kinds for me.
Yeah, I knew that was coming.
But that is a challenge, that those names are way too similar.
So I think the next thing is just to
yeah, sorry.
review and approve the bills.
Do you have a financial report? Anything to do? It's on the agenda, so if not.
I had a couple of checks. I just wanted the Jackson County Circuit Court for garnishment.
That's probably an employee.
Yes.
Okay. And then Equal Start.
That's the back to school fair.
Okay.
Yeah, and we budget $10,000 per year for the back to school fair that's held here.
I missed that. So, okay. All right,
And this year, and I'm sure we talked about it after it happened, this year it went so much smoother.
Yeah, it was good. Fewer vendors, that helped a lot. We had too many vendors 2 years ago.
So Susan, do you have anything from your report that you want, or did we pretty much cover everything?
no,
we
those
wanted
were
to
the
talk
only,
about?
from the financial report? For
Yeah,
the-
is there anything that specifically you
That's
want to
what
talk
I
about?
missed. Finance
Okay, we
committee.
missed
I
that.
skipped that. I'm
Yeah,
sorry.
we're kind of going through some of the stuff as we go along, but we
Right.
met a couple of times over the last month, just that we put the final touches on the budget on that was on December 4th, and that was mainly a budget meeting, and then we met again on December 10th and did the final kind of budget issues. We're gonna talk about the reserve accounts policies coming up. We tweaked it just a little bit, and we've got some fine tuning. We just want to see that. Do we wait for that, or
Yeah,
we
'cause
wait?
the other thing was the tuition
And
reimbursement.
the tuition reimbursement, yes, policy we discussed. And we discussed most of the issues. But I think those things, we've already,
Almost
everything's coming
everything
up.
that was in the finance committee ended up being
New business on us.
either new or old business
Yes.
tonight.
Okay. So we can
All right.
review and, without objection, we can move on to review and approval of bills.
I make a motion that we pay the bills.
I'll second it.
Roll call.
Yes.
Susan, yes. Michael, yes. Jeff,
Yes.
approved. All right, new business.
Is there a fee resolution? So you're right, Doctor.
There is not a fee resolution change.
Just
Not
going
a
by
fee
what, I'll print one out next time after running.
So let's let Dan get past all the, so in your packet, there's a memo from Taylor. Do you want to discuss it?
Me and Dustin.
Oh,
Sure. So Andrew and I have kind of discussed this in the past. I know it's a big passion project of his, and as we're working with accreditation, we thought it'd be a really great way to help develop our workforce as well as retaining our staff by offering tuition reimbursement to help enter more credentials, continuing education, and it could be across any aspect of as long as it aligns with our mission and our goals here at the health department. So our proposal is kind of to help pay up to 50% of employees' tuition, up to $5,250 per calendar year for qualified participants. So employees would have to be here employed full-time or part-time for a minimum of 1 year. They have to meet at least 80% of meets expectations on their latest performance evaluation, as well as have less than 6 episodes of unplanned absences throughout the past year. And then in addition to that, to ensure that we're not just giving them their tuition and then they just leave after it's all paid for. We want them to work for at least 2 years following that. And then if they leave for prior to that, they'll be kind of a little prorated depending on how many months remain after that last distribution.
Yeah, Andrew and I have talked about this in our little meeting. I think it's a great plan. We actually tried to figure out the logistics of it all, how long it would take to finish whatever the program might be and all that fun stuff. And it seems like the amount of money that we're talking about here actually would be very useful. I was concerned that maybe it wouldn't be enough, but it sounds like it's almost perfect. So.
and the 5,250 is what the IRS allows. So anything above that that an employer may contribute would actually start counting as income. But as
Right.
long as you stay under that 5250 ceiling, it's just reimbursement. And most of the places that I've worked with has had this. The student kind of comes up with that first chuck, and then they're using their reimbursement to pay for the next semester.
I would suggest that you might want to pass this along to some of the public health schools and let them know that we have this option available, if that entices people to look into working for us. So use it as a marketing tool for sure.
And then a draft of the policy is attached as well.
Right.
Okay, I can make a motion. I move to approve the employee tuition reimbursement policy for the Platte County Health Department.
I'll second that.
Dr. Chaffee, did you have any questions? You were looking at something, so I just wondered if you had a question.
From what I understand, this is going to enhance our current employees for their professional development while making sure those expenses would be prorated paid back should that employee leave within less than 2 years.
Yeah, in the policy, and I wrote this part, so I really like it, but it says, you know, the purpose is to recruit and maintain a competent public health workforce with considerations for succession planning, something we've talked about in this room multiple times. It'll improve employee skills. It's going to reduce training costs, increase employee engagement, and add value to PCHD's performance and image. And it's really just that we're well educated and we're supporting our staff to take it to the next level. And, you know, we have talked about succession planning in here.
Yeah. No, I'm highly supportive as long as it's structured and that there is a guideline, an approval process, who approves, et cetera, as long as all that's inked, which I have come to expect from this team. Just apologize. Sometimes I have to do my due diligence and make sure that there is a guideline in place for how it's to be executed and administered. That's in place. We're good.
Yeah, so basically, the way I look at it, it's to make sure that our future employees get interested, but our current employees, that their goal should be that they become a director, whether it's at us or some other health department in the state or out of the, somewhere in the United States. But the goal is succession for us, but also employee engagement and improvement, that they can become directors someday themselves.
Or, another type of management position,
Or different position, but that they're pushing themselves to something bigger and better.
Absolutely. And I think, when we discuss this policy, some of it is, I think we think very similarly to the board. So we are wanting to make sure that, we don't want someone to come in, get the tuition reimbursement and be out the door. That's not very helpful to us. We want to make sure we are building our team and keeping them around, because we want them to be able to move up and serve. And that's adding positions, that's all been our goal.
And it makes us a lot more competitive to some of our partners out there, like different health departments that we're having a program like this. I know there are a few who do offer it, but this will definitely help. Because I know we've talked about this before about how nursing is very competitive for nurses right now. So having something like this be able to offer would be something to help kind of lure in more applicants.
I wholeheartedly support this, and just making sure that, and again, as my experience with this administrative and leadership team is becoming, I don't want to assume anything, but confirm. That's the only thing. I apologize if anybody takes umbrage to any potential insinuation there might have been. There's none. I just trying to do my job and make sure that it's not throwing money at stuff that isn't being managed appropriately. So.
Yeah, I think I wanted your questions because we had lots of questions for each other. We really challenged each other on this particular project as we went through it, and all had good ideas and good points, except for Dan. So,
well, it certainly is also an opportunity to point out to new potential interviewees and recruits. It's another carrot that can be hung out there.
Yes.
Mm-hmm.
And it benefits the staff, and it then eventually benefits the citizens because it's improving our staff. So I wholeheartedly support it. So I would entertain a motion on the tuition reimbursement.
We already did this. You just got to do that.
Roll call vote. Susan?
Yes.
Michael, yes. Jeff?
Yes.
All right. Multitasking isn't as easy as it used to be. All right. Reserve account policy change.
So we just made one minor change on page 52 of your packet, or page 3 of the policy. And originally what it had in here was that we would look at the lowest actual cash balance at the end of November. But that may not be where the lowest cash balance is for the year. So we have just basically changed it to, it's going to be, we're going to look at it at the lowest actual cash balance on the previous year's monthly financial report. So we'll look at end of month for all 12 months, and we're going to base it on that. And that's the only change.
And then it
And
would
then
be
we'll put the money
in February.
in February. Or before the end of February.
Right.
I'd entertain a motion on this item.
I move that we accept the change to the reserves policy as stated.
I'll second.
Okay. All right.
Roll call, Susan.
Yes.
Michael, yes. Jeff,
Yes.
motion passes. Okay, the most CP Innovative Leadership Award.
So I have the privilege of going to Camdenton for the Mosaic annual meeting. And one of the things I got to do while I was there was accept the Mosaic or Missouri Center for Public Health Excellence Innovative Leadership Award on behalf of the health department and our health education team. I may have mentioned it earlier this year, and you all actually approved the income, but our normal MCH grant is about $25,000 a year. This year we were offered about $75,000 more in addition to that 25,000, but we weren't offered it until the very end of the grant period, and there was 30 days to spend $75,000.
Wow.
We were able to, I mean, Dan and his team came up with a plan, implemented the plan, but part of the plan was to get water bottles, typically kind of swag type things that we would give out at health fairs and different things, some of the different events. But Dan's team kind of thought, hey, doing that, those water bottles end up at the thrift store or rolling around on the bottom of someone's floorboard or in the trash. Let's see if we can do something else. And what they did was they enlisted the help of a college student from Truman State and said, hey, we want to know what is the trending, cool TikTok version of a water bottle out there. What is it? And so because of that short 30-day time frame, this college student who had basically 4 or 5 days to do this, but over the weekend got 60 responses from teens, and it's in the packet, but she had surveyed about 7 different water bottle brands: Hydro Flask, Thermoflask, Hydro Peak, Owala, Stanley, Yeti. Which of these are the cool ones? Well, it came back almost 90% or something. It was the Owala, 40 out of 60. So I guess 75% was the Owala. So that is what the staff went with. And there's a picture in your packet of kind of the result. And so now staff are going to the health fairs and different things. They're providing the Owala water bottles. They also, mental health was one of the things they wanted to also have some impact on. They bought all these healthy mental health stickers, sayings, and different things, all different. They were relatively cheap on Amazon, but the kids have they've loved the water bottles. What the staff told me was, we're asking questions in a classroom setting, and before we even ask the question, the hands are going up just to hope they might know the answers so they can get one of these water bottles. And it's kind of the same way in their programming at the health fairs. I think Trisha said that she kind of felt bad because everyone's at our table and no one's at any of the other tables. It's like they're the health department rock stars with these water bottles. And the kids are using them, from what I hear. They're not carrying around a Monster energy drink or any energy drink or a sugary soda or whatever. They're carrying this
Or
Owala.
they poured it into their Adwala, duh.
They would never do that. They would
No.
only put water in,
No vodka.
not vodka like Taylor would do.
That's happened to me at the high school before.
But it's just been amazing. And there's a great picture, I believe, Dan, if you scroll down.
Might that be?
And you all have the award up there. You can keep scrolling. But there's a great picture of our team with the plaque. And you don't need to show that. But you can go back up to the one
we
with
get
Trisha and her
one.
team.
That's a pretty color. I didn't see that.
I love this color.
I picked that especially for you.
Thank you. When I saw that,
And I think that's just the nomination. So you would have gotten that in the packet, but there is the nice plaque. And just to be clear, Dr. Chape said something to me, but we did not print that. That was actually
I'm
given
teasing,
to
I
me.
was teasing, of course.
There's a picture of me receiving it, so I have proof.
And that college student's name is very similar to our directors.
So my daughter did the survey.
I wonder when we said Truman State. I don't
Great.
wonder.
They're doing nepotism now.
Yeah, she got paid so much for that. She got begged to do it, and she, of course, is in college, so it was not the right age group. She needed kids in middle school and junior high and high school. So she actually got all of her friends who had siblings to fill it out. So doing that all in a weekend and getting 60 responses.
Sounds like
I was
innovative
pretty
leadership to me.
Yes. And
Okay.
today is her 21st birthday.
Well, I want to
Congratulations.
congratulate
Happy birthday.
you,
And
your
actually,
dog.
hold on a second. And when's your birthday? Tomorrow? So you guys have like almost the same day?
She always said, so yes, mine's tomorrow, and she always says I was her birthday present. Or she was my birthday present. Well,
Yes.
okay.
Was my dad, I'm the 17th of January and he was the 19th of January.
Okay.
So that's, and I was a girl. There were 4 boys and I was the
Oh,
5th.
you
and I was
were
a
a
girl. Yeah.
You worried.
Well, for the record, I want to just state that this is just this comes out of the effective leadership that Platte County is blessed to have. And it's just a symptom of what's going on at the core of here. And I think that the credit should go to the leadership team at the Platte County Health Department. And I'm very proud of all the work you guys are doing. And this is well deserved. And I think much more is deserved. So
Well
Thank you.
stated.
I agree.
any other items?
Okay, so I know that Mike would like to bring up a topic if you feel motivated still to do it, or if you want to wait, but you have the floor to say what you need to say.
I want part of the minutes to be reflect that I did attend the commissioners meeting on Monday. I got to hear a lot of the citizens of Platte County expressing concern over the tax initiative for a children's services fund. And for the record, it is the purpose, let me get this up here. The mission statement for the Board of Health, and I'm going to read it for the record. The mission statement of Platte County Health Department is to ensure conditions that promote, protect health and equity, prevent disease, and improve the quality, safety, and length of life of all who live, work, and play in Platte County. I heard a lot of the public make statements about concerns over children's mental health Family Services, and regarding that there is a huge need, and that is the nidus for this recent sales tax. As I've stated before, there's no role for politics in the administration of health services. I'm going to reiterate that. But what caught my concern was, is there a substantial need in Platte County that the health department and the board of trustees and the administration of the health department is unaware of? Because the enthusiasm, the concern for lack of adequate mental health for children, adequate resources for children and services was raised. It certainly caught me off guard as a board member that I currently was unaware that there may be such a need in Platte County. To that end, I began to look at the data published by the Department of Mental Health in our county for as far back as I could access it. And then I began to look at the same data for Clay County and Jackson County. I want to know if we have a problem. I want to know if we are underperforming, if our citizens and our children have a paucity of resources and access that this recent sales tax attempted to address. In my evaluations, I saw $20 million that Clay County, through their children's tax fund, had administered over the last 5 years. And my curiosity has caused me to request somehow that we do an in-depth analysis starting from about 2015 to evaluate the effectiveness of how the funds have been administered in Jackson, Clay County, and compare their outcome data with Platte County. To the extent that, do we have a problem in Platte County is what I want to know. To the extent, how effective is the children's services funding and how it's being funded? Is it making a substantial improvement in the outcome data as published by the Division of Mental Health? Because if we do have a problem, I believe it is every trustee's duty to look to see if there's a problem and how best to address it and to cost effectively use the taxpayer money to fix the problem. I don't know how best else to proceed. I certainly can take up this on my own, but I have looked at it and I think I'm going to need some assistance with it, but I would be happy to participate with any of the staff in trying to look at a statistically significant objective evaluation of the data that is available.
Can I intercede real quick? Because I
Please do.
Statement.
Please do.
So from reading the ballot measure, it was vague, but it seemed like the mandate was to provide the services, whether it's mental health or just child services in general, for Platte County children. But the problem that I saw was that it's almost too vague. Like, we need to know like specifics, and I think with what you're trying to accomplish, I think hopefully would find what the specifics are. If there's something specifically that is a major issue that we're overlooking or not aware of, what would be the best way that we could go forward to try to take care of that issue? The fund would gather about $5 million a year, and so that'd be a significant amount of money. But I just don't want it to be spent on things that don't actually help whatever the specific concerns are. I know that from what I saw from the meeting, there's a lot of anecdotal concerns, but I would like to have actual like hard data, kind of what you're alluding to, so that we know what to at least address and then go forward with. And I know that you want that information, and I would hope that Andrew and Dan feel the same way. And then from that point, we can maybe attack whatever that concern is and figure out the best way to provide the services that are needed for Platte County citizens.
What struck me was the perceived need versus where we really stand. If this and the citizen, how the citizens of Platte County want to vote is up to them. what they want to spend their money on is up to them. But it raised a concern for me that there was such a children's services mental health need that should come up to the Board of Trustees for an evaluation, because that's our job, the health and wellness of all the citizens. And I heard a lot of folks who were reporting they perceived that it was inadequate. If it's inadequate, I believe I'm going to ask this board to evaluate it and to find ways to address it and to measure it and measure the effectiveness of each of the interventions we do, as well as the fiscal efficiency of those interventions. So I'm done.
Agreed. And then the one thing that when I was reading the ballot measure, it said that no inpatient psychiatric services would be that funding would go to that, and that would be one question I would have is why is it? So is that a need that's already been found to not be a concern, or I guess I'm curious, because if there are children that are suicidal and they need immediate acute care, the funding wouldn't go to that, and it was specifically stated that. So I'm curious why that was in there as well. And I don't know if we can find that out with our what you're planning on doing, but it would be something that we should look into as well. I'm just curious. So
one of the things I'd like to do is have staff start working on this. We'll present to the board next month, kind of our preliminary, and we'll bring back what we can. There's a lot of data out there just on some of the things that you talked about. There's not a lot on some others, and whether the monies that have been spent, doing an analysis of whether it's being effective, some of that's a little tricky. I'm not sure how much of that we'll be able to bring back next month, but we can at least bring where is Platte County currently based on the data that's available, and we can do that quite well, I believe. Taylor and I have talked about this. Dan and I have talked about this because both their teams have different aspects of this, and there's different data sources we'll pull together, much like what we do for the community health assessment, as you had mentioned. Assessing the health of the community is something we do, so it's something we can do.
And I wonder if you would, in contacting the schools, because the social workers I know deal with a lot of.
And I believe that's one of the data sets that
Okay.
is in there.
Okay.
So we'll at least present our initial blush next month. It may take a little longer. I mean, the scope of this may last a little longer, but we'll see what we have. I know Dr. Chape, you had asked to be included. So Taylor and Dan, I know your teams are already working on it, but we will meet before.
My desire to be included is to help guide the team in making sure that the data is statistically significant, comparable to other counties, and that we can look at trends, not just, and where I actually started this on my own. I have a spreadsheet. I have read every report by the DMH for the 3 counties I mentioned before. I began looking at the comparisons, but what I saw needs to have denominator data. In other words, these counties have grown over 10 years. They have implemented a child services fund. They have funded vendors to have interventions to improve the health and safety and mental health of children. Wonderful. So having said that, I believe that we would need data before and after the child administration of child services funds, because I think looking at the effectiveness in other counties, should this come back up on the ballot, I believe the health department has a duty to provide guidance into the most effective expenditure of funds to help the health and welfare of the citizens, which includes children's mental health. So denominator data, looking at the growth of the counties, looking at the reports. I have read all of the surveys that were done for all the schools. I can probably quote you a lot of data, even the amount of substance use, thought about suicide, etc. There is a lot of data there. And I think we need, as I ran on a campaign of data-driven decisions, I am not weighing in on the appropriateness of the citizens of Black County to have voted and passed this. I'm trying to make sure that as a Board of Trustee member of this health department, if there is an unmet need or a problem, I'd like us to evaluate it, get objective data, so that as we move forward, any interventions we have, we can measure the effectiveness of them. Part of that would be to look at how are other counties improving the children's mental health services as they move forward. To this end, I will be inviting Dr. Kingsley and any other Board of Trustee member to go to a lot of these service entities who were supportive of this tax to gather data from them as to how they perceived and why they pushed for it, because I think that they must know something we don't to support this. I think inquiring as to Synergy Services, to Beacon Mental Health, and to other folks who are recipients of funding in Clay and Jackson County would be reasonable, because clearly they see they have gotten behind this to push this, which they may be doing some great good we're unaware of. But in order to work and help the citizens of Black County and meet our mission statement, I would be interested in helping in the initial phases to make sure that any work we do and data we gather goes towards us helping improve the health and welfare of the citizens of Platte County.
Right.
Not to try to channel where we're headed with this, because there's no role for politics. This is an evaluation of how we can do the best for our citizens and look at other counties, how effective they've been able to do so. And if at the end of the day, we find out we need pediatric psychiatric beds, I am willing to spearhead, and for the record, finding a way to put together a public-private partnership, even to put a children's mental health hospital, and to get our state legislature to help fund such an initiative if necessary. But I don't want to go treating something that I don't know the symptoms of and can't measure the effectiveness of our treatments. So
Yeah, I agree with that, because you could, let's say you pass this bill and it becomes a real thing. You have this $5 billion budget, but you don't know what you're actually spending the money on, and you can't show that whatever it is you're supposed to be spending money on shows either success or failure. That becomes a boondoggle in its own way. I agree with you. Data driven, no politics. Can this be done? Can we improve? And can we show that there is improvement?
hey, if I'm going to go from my memory here, but I think I may mention this before. I think Jackson County may have spent $50 million in the last 5 to 6 years through their Children's Services Fund. I have looked at the vendors who are providing interventions, and I boiled that down. So if I want to see what our Platte County's data is compared to theirs before and after those interventions, because I think if the citizens want to still enhance and improve the children's mental health in Platte County, I think we have a duty to provide the best data available on how to most cost effectively do so.
What to me would be interesting is if let's say Platte County's suicide rate for kids is going down, meanwhile Clay County or Jackson County's suicide rate is going up, and they have the fund to have the access to these funds to pay for these services, and it's not being allocated to the right services to help alleviate that. That would be something that people would need to be aware of.
I concur, and I already have all that data because I have all those reports, but I think that we're going to need some data prior to what is currently available at the DMH website, which may mean we may need to request some backlog data to look at this, because I think my opinion is from 2015 to 2024, as much data as we can get on these 3 counties and other counties if the staff deems that appropriate to make comparisons. Again, I want to be very cautious, and I've had a conversation with Dr. Kingsley, with Andrew, with Dan, that the perception of political motivation here is concerning to me. But our duty is to the citizens of Platte County, and I think that we are professionals and scientific and data-driven. We can look at this, and that's the purpose here. Some of that, I'm going to be asking any of the other board members to go and meet with me, to meet with Synergy Services, Beacon Mental Health, and to make a direct inquiry as to what are they trying to get done? What is the data that is driving this? How can we best help them? Because that's our duty for the citizens of Platte County. And I feel like in the last year, I must have failed the citizens of Platte County because they needed to vote a sales tax in place for a problem that I currently am not aware of.
Hey, Andrew, just quick question or statement. Is it possible to talk to your counterparts at Clay and Jackson County and find out what the impetus was for them to have that put on the ballot measure in their counties and get passed? Did they have specific issues that needed to be taken care of? And were those issues taken care of once the Child Mental Health Fund was actually passed? I guess that would be something we should be aware of to know as well. And then also the boards that do run these funds, is there any way to contact them and ask them how they see the money being spent, being effective, not effective, that kind of thing?
Well, I get there is, but I would say, at least as far as I'm concerned, what I'd really like to do is work on the data first. Sure. Because I'll tell you this, I'm not a mental health professional. That is not my area of expertise. What the best practices are to bring some of these indicators down, different things, that's not really in my wheelhouse. It is well within my wheelhouse to evaluate these numbers and look for statistical differences and do that type of thing. So what I prefer to start with, if the board's okay with it, is to start with these numbers, and then we can decide what those next steps, what is reasonable would be. But sure. Measuring the effectiveness of what other counties are doing, hopefully they're doing that, but that's going to be hard. One of the things that I had told Dustin today is, you know, syphilis seems to have just really big peaks and waves when it comes to funding. And what we noticed is when you put more money into syphilis surveillance, guess what? You find more syphilis. If you put more money into trying to find mental health issues in kids, you find more mental health issues in kids. Does that mean, you know, it's one of those tricky things where the numbers don't always tell the entire story. I think we'd have to do some research. I'd like to figure out where we are at in Platte County. Then we can start looking. You know, one of the things about the Department of Mental Health data that kind of frustrates me, and I've told Taylor this and Dan, that I'd like to know, is we have fairly decent numbers for Platte County and some of that info, and fairly good state numbers for comparison. But where's that nationally? You know, Missouri's 51st, and we're better than Missouri, but we're worse than every other state. That kind of changes the picture. I don't believe that to be the case, but we need to know, for comparison data, we need more than just the state too. So
I would concur.
Right. Yeah, I have another suggestion, Andrew. It just came to me. Children's Mercy may have already done a lot of this work, and so it might be good to see if they already have all this data, so we don't reinvent the wheel.
Well, I think so. As soon as I have talked to Taylor, and I don't know if she's been like, her brain's been smoking, like just steam coming out because of all the different places she's trying to figure out where to get data and stuff. And I know Dan's talked to his team. And so I'm in the midst of fires both sides, but they are truly trying to not think outside the box, just look for every resource to so we can paint an appropriate, complete picture, if that makes sense.
I would ask
I agree.
Drew, yeah, you believe there would be a benefit to having an ad hoc committee of Board of Trustees participate with this, or I don't sense that need, but I do want to volunteer my availability to help the team make sure we have good data that we can use. I concur. We don't need to make the comparisons to other folks until we see where we stand. But if we are going to begin to make recommendations on how best to improve the children's services and children's mental health in Platte County, perhaps at some point down the road, it would be reasonable to look at the cost-effective measures that other counties close to us have done. So prioritizing the data gathering, then taking the next steps after that is, I think, extremely reasonable.
Yeah, I think getting the data first and then deciding what that next step might be.
Now,
Makes
would
sense.
our data, I mean, I'm not for sure. I think the commissioners voted down the tax, or how did they, it's on hold right now, or
Well,
what did they? Because since the voters voted it in, and I don't know what percentage that was.
56.
Okay, so 56%. And I mean, in our heart, we all want to help children. I just want to make sure that money is spent in a good way.
So,
But
Susan,
and being a school nurse for 13 years, my feeling is, yes, there is. I feel there is definitely an issue, but yes, we don't have the specifics on the data. So
I want to try to
so Susan,
avoid.
my understanding of the ballot measure, though, how it was written can be interpreted multiple ways, but one of the major ways it's interpreted is the voters voted to allow to give the county commissioners the ability to choose or choose to not accept the tax levy. So I think my guess is, since it's failed, the county commissioners have voted it down, that it'll probably be on a future ballot, which is kind of what Mike was alluding to. So I think it would be good, it would behoove us to have as much data ahead of time, so when that bill is being formulated, that ballot measure is being formed, that maybe it's very specific and to certain things that do truly need to be fixed, or at least looked at, or try to alleviate the problem. We know what we're supposed to be targeting. And I think that's where the health department can really step in and take that role.
I'd be happy to help there anyway too.
I don't want to get involved in the tax initiatives unless this board deems it appropriate.
I understand.
In the meantime, I think this board has a duty to evaluate the status.
That's what I'm saying. I agree. And what I was trying to say, though, is have the data available for whoever does make the ballot measure, that they can use and access. So when they make their decisions, whatever it is that they choose to do, that information is available to them.
Thank you.
Already started looking into it, and we will provide more detailed information. I will just say, already with conversations with my team, it's something that's really hard to measure, because knowing who was going to commit suicide or not is so hard to even count. So I know that was one concern of our team. So we'll try to see what data we can present that's, I mean,
If you guys haven't
objective.
pulled the data, I have it, all the published data on the DMH website for Clay, Jackson, and Platte County.
That you've compiled. You want to send that to me?
I've not only compiled it, I've read every page of it, and I've already made the comparisons myself. I couldn't draw any formal conclusions about the effectiveness of the administration of the interventions without data prior to those interventions being instituted in Clay and Platte County.
And don't forget too, guys, don't forget too, that it's more than just suicide, but it's depression, anxiety, all those things, anything that might be a mental health issue that would be debilitating enough that it affects the child.
The student surveys are performed every 2 years. There's good data in there. Again, it's data, but how actionable it is and statistically significant is up for interpretation. However, it's still information and data upon which trends might be perceived. So yes, I do have all of this, and I'm happy to send it to you within the next few minutes.
So Taylor, would you set up a meeting with Susan, Dr. Chavez, and our team in like 2 weeks?
Okay.
And in the interim, I'm only
Very
just telling her to do it. I want you involved in your team too,
Well-
so it's.
And I would like to make sure that the executive team will feel very comfortable at our meeting to provide any feedback and guidance and direction to make sure we are performing the appropriate duties of the Department of Health for Platte County. And that this is not a politically, it is not, and I go on the record here, it is not a political motivated action. I
Oh,
was
I don't think
actually
we have the
so
data.
concerned because I watched citizens who are my neighbors become viscerally emotional about this subject matter. And this subject matter is in our wheelhouse. To
Yeah,
that end, this is why I'm motivated to suggest we pursue this.
So as I kind of said, I think we are quite suited to look at the data, present the data. I'm going to say I have more concerns about, what's the appropriate intervention, what effectiveness of other programs, because we are not probably positioned well to do some of that. But we will see where we're at and, I think move forward from there.
I think even we get the data and present data to the community so that they can see, and it may give them a more well-informed way to vote. I mean, not that I'm trying to say one way to vote or another, but it gives them a little bit more statistics on how, oh golly, okay, well, this is what's going on in Platte County, so I'm gonna vote, we may need something like that.
I don't think I have thoroughly reviewed, well, I know I haven't looked at it like Dr. Chavez has, that data, but I have done kind of a quick review of it, and it's interesting, but it's not a complete picture by any means. So I think pulling together every resource we have, we may be able to paint a better picture.
Sounds good.
Fair.
Yep,
Thank you.
sounds
Yep,
good to me
sounds
too.
good. Shall we move on? Do we need to move into executive session? Do we have items to consider?
We do not. The only thing I will say is the health department will be closing at noon on December 24th, and we will be closed on December 25th. So just so you know, is Andrew gone again on the afternoon of the 24th? Apparently, yes, is the answer.
And January 1st.
And January 1st. Taylor's on the make sure.
Yeah.
Do you guys close early New Year's Eve though, or no?
Typically not.
Okay, that's a full day. All right, very good.
Why did you think we should?
No,
Don't-
we're paying you to work. Come on, guys.
Don't tell her that. She doesn't need much of an opening, Dr. Taylor.
Yes, I'm more.
I have them on my home computer and only access to download them to my new desktop here. So
Well, it doesn't have to be this moment.
if I don't get stuff done, I forget.
Oh.
Okay. Any other business? Hearing none, I would entertain a motion to
I move that
stop the
we
meeting.
in the meeting today.
I'll second it.
Roll call, Susan,
Yes.
Michael, yes. Jeff,
Yes.
thank you for the meeting.
Thank you, everybody. Merry Christmas, Happy New Year's, all that fun stuff.
Merry Christmas.
Ditto.
Bye.
It's